So today we're going to talk about the Epstein Barr virus. And I am really excited to talk about this. I'm amazed that we have not talked about it sooner. Carol and Julie, thank you for bringing this up to us last week. This is for you. And this is going to be one of my favorite ones because I have to deal with this almost every day in the consultations that we do here in the office. The severe lack of understanding of Epstein Barr virus, what it is, what it causes, what it doesn't cause, its relationship to fatigue, its relationship to the immune system, and on and on and on and on and on. I'm Dr. Martin Rutherford. I am a certified functional medicine practitioner. I'm a chiropractor, 29 years also. And
are you longer than 29 years?
36 years, yes.
Yeah.
36 years. Whatever.
Dr. Randall Gates, I'm a board certified chiropractic neurologist as well as being a chiropractor. I'm sorry to interrupt you there.
No, that's okay. He pays a lot more attention to detail than I do. and so this is we have two separate disciplines here. They're both functional disciplines. In other words, when I have a patient that comes in and the patient has fibromyalgia. I had one yesterday that was a perfect example. She probably doesn't have fibromyalgia, but she was diagnosed with it. And I assured her, look, it doesn't matter what the name is. We're looking at what's not functioning in you. And if you look at our fibromyalgia work, most of these folks have a bad brain, bad stress mechanism, and bad nervous system. And that's where Dr. Gates's discipline of functional neurology comes in. And then the rest of the metabolic issues are covered in functional medicine. In other words, we also explain to this lady, look, you're probably gonna have a bad gut, you're probably gonna have a bad thyroid, you're probably gonna have bad stress. The two of these disciplines put together can address these things. So that's functional medicine. And Epstein-Barr virus comes up time and time again in the types of things that we see. We see it in the fibromyalgia patients, which is one of the reasons I use that for an example. Most people associated with chronic fatigue. So we see it in the chronic fatigue patients. And a lot of people come in with very, very fixed ideas about what Epstein-Barr is, what it isn't, or they run the spectrum to not knowing anything about it and wondering if it's even an issue. It's kind of a unique topic for me. We are in Reno, Nevada. As with always, I had Epstein-Barr virus. I was talking to Dr. Gates before this. I said, anybody's watched like all of these presentations is going to say, you've had everything. And I have. That's why I'm
Almost
doing
everything,
this.
yeah.
That's why we're doing this, okay? So I had this. I experienced the acute aspects of it. We'll talk a little bit about it causing mono, I think, in younger folks. And I experienced it in full-blown glory. Then moved here from New Jersey to Reno and right down the street from Incline Village, Nevada, which is at unbelievably beautiful Lake Tahoe, where a doctor up there kind of classed on to Epstein-Barr virus as the cause of chronic fatigue. Right. And I want to bring that out because that's where the whole confusion really took off. And this doctor has since, I'm not going to mention his name, okay, it would be unfair, because this doctor has since, I've noticed, we get some of his patients occasionally, and I've noticed that he has changed his position in the way he is ordering his tests and so on and so forth on Epstein-Barr virus relative to it being the only cause of chronic fatigue. So this is a very interesting subject. It's interesting to us because we see this every day. And I'm just slightly exaggerating on this. And thank you, Carol, and thank you, Julie, for bringing up to us that after doing 200 hours online, I think, around somewhere, we haven't addressed Epstein-Barr virus yet. So let's do some background data on Epstein-Barr virus.
Okay.
And I'll defer to you to go through that, and we'll kind of kick this back and forth.
So in essence, 95% of us are going to have Epstein-Barr virus at some point in our life. Typically, children will get it, and if they get it, they'll either have no symptoms or they will have the symptoms of like a common cold. And then if you get the virus when you're a teenager or your early 20s, you about 50% of the time may develop infectious mononucleosis-like symptoms. That's where right. You get extremely fatigued, you have a sore throat, you have a fever, your liver may get enlarged, your spleen may get enlarged, your spleen may rupture. It's a serious condition that requires bed rest in essence until you start feeling better. And then if you get as an adult, you can also get those same symptoms of infectious mononucleosis. So that's kind of the background on it. It's technically termed human herpes virus 4. It's a herpes virus. And it infects us, and then our immune system should be able to re-regulate the virus and keep it at bay, in essence, for the rest of our lives. However, today we're going to discuss extensively that in chronic illness, including chronic fatigue, as well as certain types of cancer and autoimmune diseases, we're finding that this virus may be rearing its ugly head again, and the immune system is not able to keep it down.
Yeah. And we've had some interesting observations that we're talking about just before we went on, and we're going to share those with you. I think the takeaway from this relative to patients coming in is they're surprised that they have Epstein Barr virus, or that we're even considering testing for it. They don't understand that you said 95%. And frankly, up until Dr. Gates had informed me of this data prior to this, I had been thinking like 70, 75, 80% of the people get it. But the bottom line is it's common. I mean, it's not something like somebody just gets, and then they go into full blown.
Right.
I had all those symptoms. I had chills. I couldn't eat. My throat was so sore. I mean, I couldn't eat. I mean, I had all those symptoms.
Swollen lymph nodes.
And a lot of people don't connect it with mono, and people are confused with mono and Epstein Barr virus. So we should get through that. But I think the big takeaway from that is everybody, you can almost say everybody gets it. Okay. Dr. Gates likes to be a lot more specific than that, but 95% is pretty close.
Yeah.
And not everybody expresses the symptoms from it. He delineated between a child and a young adult. And then we're probably even going to delineate a little bit further into our patient population as to what it is, because we don't, just because a person comes in, they have Epstein Barr virus, or a lot of people will come in with their testing already, and then we retest and it's still active. That doesn't necessarily mean it's part of what's causing their chronic fatigue. Right. And I think that's really the biggest takeaway I want you to get at this point in this presentation, whatever you want to call it. And the lab testing is
it's a great area of confusion.
Yeah,
especially
I would
where
say interesting.
What is the title of our talk? The myths and the
Dispelling the myths and confirming the facts. The facts according to Gates and Rutherford. And what we observe in our patient population, frankly.
And I put into the little blurb that's underneath this broadcast how we're going to talk about some of the clash between mainstream medicine's views on Epstein-Barr versus the complementary and alternative medicine camp. And a lot of this comes down to the testing. So in essence, if somebody thinks you have mono, they may run something called a monospot test. A lot of you have heard of that. A monospot test has a lot of false positives and a lot of false negatives. So
I want to explain that.
Meaning,
false positives and false
okay, so in essence, if they do the test, you may have a false positive, meaning the blood test shows that you have mono and you may not have mono. And
this is
it also has a lot of
people come in, my blood test said I got it.
You also may have false negatives where you actually do have mono, but the blood test says you don't have mono. Right. So the monospot test is just something clinicians kind of use as garnishing more data for their diagnosis, because the diagnosis with mono is a clinical diagnosis too, where you look at the person's symptoms, their fever, their sore throat, their swollen spleen, all those features.
So if you come in and you have all that, but you test negative for it, we're going to treat you for mono.
Right, exactly. We just had 2 cases of mono in the last 2 weeks. So there's that piece. Then there is the Epstein-Barr VCA, the viral capsid antigen. That typically goes up early in the course of the disease process. Then there is the Epstein-Barr virus early antigen, IgG, which we test for, but that goes up early in the disease process as well. However, about 20% of patients will have an elevated Epstein-Barr virus early antigen for the rest of their life. Then there's the Epstein-Barr nuclear antigen, which also goes up early in the illness, and then it should come back down. Excuse me, that can actually stay elevated for the remainder of a person's life. So we don't really test for that because that's not as good of an indicator. But within alternative medicine, a lot of the doctors are using Epstein-Barr virus early antigens. And even though 20% of the population in the country will have a positive antibody titer for that, Dr. Rutherford and I were discussing that at least 80% of our patients have a positive early antigen
And I was going to
coming
say
into
that
our
later,
clinic.
but
Yeah.
basically we put our two disciplines together to start to treat. We started with fibromyalgia and then peripheral neuropathy and then restless legs, and our practice essentially on its own evolved into an autoimmune practice.
Right.
So most of our patients, I'd say 95% of our patients or more, have autoimmune problems.
Mm-hmm.
So, and we have found that this is significant to the autoimmune patient. Is
Very
what you're
significant.
saying. And just to step back, you know, not that we expect everybody to get all the distinctions between this testing. My point, our point there is patients come into me and they say, well, you know, I don't have it. And they're sitting in front of me with every single symptom of Epstein Barr virus. And they're saying, I don't have it. This, and they say, well, I tested and I don't have it. This is why. Okay. I don't know if it's fair to say that testing is inconsistent and unreliable, or that it's just in an evolution and it's not completely developed yet.
That's a great point. And
But
that
you
is kind of
have
the
to-
crux of the issue.
Yeah, you
because
have to
basically,
put that together with a good history and a good
absolutely.
good evaluation, good exam.
And a lot of doctors out there may just test for the viral capsid antigen. I've
And
seen a number of patients, or the nuclear antigen. And lots of times those are not really what you want to be looking at when we're looking at more of a chronic issue. You have to look at the early.
So they might be doing the raw
IgG.
test. They might be doing the test that's not consistent. But the point, again, I want to make to you when you come into me and tell me that you don't have it, is that the doctors are going off those tests.
Right.
They're not going off anything else for the most part.
Let's say it this way.
Okay.
Everyone practicing medicine, including functional medicine, functional neurology, we all tend to get dependent on the lab test.
Not all of us.
Not all of us, but many of us. It's
Right.
an easy, slippery slope to fall into.
It is.
And so we want to go off of the test. And with EBV, we just can't do that. In fact, I put an article in today's broadcast demonstrating that the memory responses of the immune system, and we're going to try and explain the immune system, but the memory responses of the immune system to Epstein-Barr are decreased through the nuclear antigen, the viral capsid antigen, in chronic fatigue patients. So the immune system doesn't seem to be able to remember this infection. And that may be why this infection is going unabated in you, causing so many issues.
Right. Kind of a stealth
Very much
entity
so, yes.
that the immune system almost doesn't see.
In certain patients.
Let's
who are
talk about
predisposed to
Epstein-Barr and the immune system, because frankly, this is how we came to kind of observe what we've seen relative to Epstein-Barr. We have kind of a flow in which we will treat conditions. Okay. When I say a flow, anybody who's watched anything that we do knows that we basically start everything in the gut.
Mhm.
And the gut can be complex to figure out. You figure that out, you get it fixed. Now you see what's left. Let's say you have a patient comes in, they have fibromyalgia and they have a bad gut. Let's say maybe it's something called celiac. They're allergic to gluten. Maybe they got a leaky gut, whatever it is. But they also have an Epstein-Barr virus when we test them, and they also have fatigue. We will not immediately, in any circumstances, go for the Epstein-Barr virus first.
Right.
We will treat the gut first. We'll treat the leaky gut. We will treat the parasite. We will treat the H. pylori, well, whatever's in there. We will not even think about going to Epstein-Barr until all of that is healed. Now, maybe the fatigue is gone. Well, guess what? We're probably not looking at an Epstein-Barr virus problem. Would that be fair to say?
That is very fair to say.
And now the fatigue is not gone, and they have a test that says they have a positive Epstein-Barr. Maybe it's the Epstein-Barr virus. They might still have a thyroid issue or something like that. So you have to kind of work those out to figure it out relative to what actually is causing that person's fatigue. But the virus is at the end, and most of these patients are autoimmune patients. That's why I'm going there. You have to wait until we clear everything else out and then say, oh, this might be it.
Absolutely.
So then we'll talk about what the relevance of that is relative to the cure or the addressing it once we get to that point. But why don't you talk about the immune system and Epstein-Barr, because I think this is really interesting as well as very important.
And explaining the immune system in 30 seconds or less can be kind of challenging.
Take
In
a
essence, the immune system is a very, very complicated matter.
I can do it. I do it every day.
I'm going to do it.
Here's your immune system.
It's a complicated matter. Just know that we're going to give you the real Cliff Notes version, very much an overview. So We have B cells within the immune system. We have T cells. Everybody's heard of T cells because HIV affects T cells. Epstein Barr virus traditionally affects B cells. B cells, from a general perspective, tend to make antibodies. So they make the antibodies that help us to remember infections, as an example. Also, these antibodies help other immune chemicals to kill whatever the bacteria, the virus, or the parasite is. Okay, very simple. There's also a Th1, Th2 phenomenon. We're not even going to go into it. In essence, as I explained, Epstein-Barr hits the B cells, but it can also affect T cells too. Now, when Epstein-Barr virus affects these B cells, as we were trying to explain relative to chronic fatigue, in those of you who have chronic fatigue, it appears that your B cells have poor memory for the Epstein-Barr virus. So it doesn't seem to remember.
These are the cells that are supposed to have good memory.
Right.
That when you have a virus and then it comes back, they should remember it, go in and kill it without activating the whole system. But here they don't remember.
That communication in the immune system seems to be off in those who have chronic fatigue. So then the Epstein-Barr just keeps rearing its ugly head. And then we get high levels of other types of antibodies termed the early antigen. But you have to have this full immune response to keep this Epstein-Barr virus at bay. And this not only relates to chronic fatigue, but it relates to multiple sclerosis, we're going to talk about the new data there. It relates to autoimmune diseases like Sjogren's disease, rheumatoid arthritis, lupus, a host of things.
Yeah, we treat a lot of autoimmune diseases. So again, when we speak about these things and we say dispelling the myths and confirming the facts, according to Gates and Rutherford, the according to Gates and Rutherford part is basically on what we've observed consistently here, you know, week after week and year after year and so on and so forth. So we can speak with some certainty on that aspect of what we're talking about. So the immune system is not remembering that you got mononucleosis back when you were 4 or 12, or in my case, after my sophomore year in college. And so that creates a very unique situation relative to testing. And then the testing relative to, is this actually causing you your present day problem? Or is this just something that's floating around and it's kind of confusing the issue? Let's talk about it relative to fatigue, because most people have no clue. In fact, I just had a gal yesterday said, does Epstein-Barr virus have anything to do with mono? So most people really, I don't think I'm being insulting saying that, because I see this day after, I see this all the time in the intakes. So she was surprised about that. But most people really seem, it kind of blew up, I want to say in the late 80s. Epstein-Barr virus causes chronic fatigue. And the medical community would have an issue with that,
right,
to some degree.
Right, because lots of times they don't even acknowledge chronic fatigue.
Right, exactly. So let's talk about that, because I'm going to guess that the people who are watching this either have fibromyalgia or some other issue that causes chronic fatigue, or more than likely they have been diagnosed with chronic fatigue. So let's talk about that.
So relative to chronic fatigue, Epstein-Barr virus can cause it. And we have research articles attached that really validate that. There is some discrepancy, again, in the literature, and we'll try and go through some of those studies. But other organisms can cause or be associated with chronic fatigue as well. Cytomegalovirus, Babesia, chlamydia, mycoplasma. And what you have to understand with chronic fatigue,
which crosses with you Lyme patients, which,
right,
by the way, we're going to talk about next week.
Yes.
Another area I'm excited to talk about.
And we did do a whole broadcast on chronic fatigue, but in a nutshell with chronic fatigue, what appears to happen is that the energy producing systems in our cells break down. They're termed the mitochondria, commonly referred to as the powerhouse of our cell. And if they break down, guess what? You don't have energy. And one of the key things that viruses do is they use our cells to replicate them. And each virus is different. Sometimes the virus replicates in the liver, causing hepatitis, like hepatitis viruses. Epstein-Barr is primarily in the immune cells. And then other viruses can affect the cells throughout our body, including EBV.
And if you're not making energy, you're not getting better.
Yeah.
If you're not making energy to get here's one of the things, one of the clinical pearls that we've observed as practitioners of autoimmune and chronic problems is you are literally taking that entire environment, biochemical and neurological environment, and putting it back in balance, which is creating homeostasis. And I think it's fair to say that if you don't have cells that are making energy, you are not going to get that patient to be able to get back to homeostasis, which is probably why if you look at a pathology book, every single disease, like the first symptom is fatigue.
Yeah, exactly.
Fatigue. They're tired. They're fatigued.
Yeah, absolutely. And so Epstein-Barr is a piece of that. And one thing that we run into clinically, it's how much money do you want to spend on lab testing? That's what it boils down to. We can test you for all these different microorganisms. In research studies, it has been done, especially in fibromyalgia patients and CFS patients. The longer you have it, the more organisms you accumulate. It can be upwards of 13 to 14 organisms we've seen in different studies. So know that Epstein-Barr virus is just one piece of the puzzle.
Oh, yeah.
It may not be the piece, but it may be one piece
right,
amongst many other things that are parasitizing your ability to make energy. So that's really a pivotal component. You want me to go into anything else, sir?
Just chronic fatigue. We wanted them to know the Epstein-Barr virus. The takeaway for me that I wanted them to get was it can be part of the problem of fatigue, and it may not be part of the problem of fatigue.
Right. Exactly.
And so, because that's what people are looking at, they've been told, the people that come in for the consults, that's what they've been told. They've been told I got Epstein-Barr virus. That's it. How do we do it? It's like the Lyme. I got Lyme. It's going to be very similar to a Lyme presentation we give next week. I got Lyme. That's it. Everything's got to be, it's all about the Lyme. And in our world, it's not. It's all about the immune system.
Exactly.
It's all about the immune system. Exactly. You wanted to talk about memory responses, EBNA memory responses.
And that kind of ties back to what I was mentioning before, and the study is attached to where this applies to EBV, as we have said in this broadcast, to where your immune system is not really remembering the infection. In fact, they're showing that the lower these memory responses are, that can actually be a diagnostic marker for CFS and EBV.
And I re-brought that up because of some of the things you said before we got on.
Okay. And I'm having a hard time.
Okay. We'll go ahead with what you were just saying.
And so, in essence, these decreased memory responses may be actually a diagnostic tool for physicians to diagnose you as having an Epstein-Barr virus chronic infection.
Okay. And I think we were talking about the immune system and how the immune system doesn't see it, or the immune system may be overreacting to try to kill it. Maybe I have those two things confused.
Possibly. And so I didn't explain it well.
Okay.
Yeah. So with the testing for Epstein-Barr, I described the viral capsid antigen, which goes up early in the disease course. Right. There's the early antigen, which we test for, which also goes up early in the course, but can be present in 20% of patients. Then there's the nuclear antigen, which can basically be elevated from the time you have infection through the rest of your life. And so within that, within memory responses, they looked at viral capsid antigen memory responses and nuclear antigen memory responses, and saw that the immune system was not remembering the Epstein-Barr virus infection. Also, we have other studies attached that show that in that same circumstance, the early antigen goes up. So it's this dysregulated immune response. So one side of your immune system is freaking out trying to help, and the other two sides are not helping with remembering this infection. Therefore, it just becomes pervasive and it becomes chronic for those of you who have these immune system dysregulation issues. Let me go into the D and C. So really one of the interesting studies we attach is that just by taking vitamin D has been shown to decrease the viral load of Epstein-Barr virus. Now, how does that work? Vitamin D regulates our immune system. I wasn't going to talk about this, but I guess we're going to.
I think it's...
Man, I'm sorry for the microphone. So two sides to our immune system, Th1, Th2, very general. Th1 does the rough and tough killing of a bacteria or virus. In essence, these are like one branch of the military. Think of all the messages sent from the generals to the colonels to the lieutenants and things of that nature. Well, that all has to be orchestrated for you to kill something like a virus. That's the Th1. Then there's the Th2 side, which is generally the precision killing of the bacteria or the virus, the remembering of the bacteria or the virus. We say that side's more analogous to the Air Force. Now, in autoimmune disease, lots of times, one side will be dominant and one side will be weak.
They should be balanced.
They should be balanced.
Always.
And the thing that balances them is vitamin D,
Vitamin
which
D.
works on what's termed a Th3 regulatory system. So it brings these two into balance and helps your immune system to coordinate better, just like a military, where our Marines and our Air Force are in unison.
And I think it's important. I mean, we just talked about this beforehand. I had mononucleosis, bad, severe. Maybe I had already had autoimmune problems then. Dr. Gates has evaluated me. He's seen all my tests. He knows that I'm not just saying this to like get into affinity with the people who have this stuff. Fibromyalgia, chronic fatigue, celiac, Hashimoto's thyroiditis, peripheral neuropathy, all this. I've had it all. And I was just telling him beforehand, I said, I think the vitamin D I take, right now I take 5,000 a day. I really think it's why I have hardly been sick in as long as I can remember. And there's a flu going around here the last several weeks, and a lot of people have had it, and I didn't get it. And I haven't been getting any of this stuff. And I really think, now I have several autoimmune problems. We're talking about the immune system. My opinion, when I see somebody come in and their vitamin D is 15, in my brain, automatically they have an immune problem that's proven innocent.
Yeah.
You know, so I think this is a huge part for people to understand relative to that. So I think it's correct for you going off into that direction.
And then lots of times we'll look at the other things that may be causing the immune system to be imbalanced. That's where we start in the gut, because we've seen by regulating the gut, you can decrease inflammatory load into the system that may be imbalancing the immune system, and it goes on and on. And this whole Th1, Th2 thing that we're talking about, it really applies to certain diseases and it doesn't apply to other diseases. But in regards to this discussion, it does apply, because if you can take vitamin D, and that in of itself will decrease viral load to a statistically significant number. That's something that every one of you watching this broadcast should be paying attention to.
So if a person has Epstein Barr virus positive, I'm not going to get into the nuances of all the different testing. Let's just say you've been tested positive for Epstein Barr and it seems to correlate with the symptoms, then vitamin D is probably a good thing for these folks to take.
Or to at least have tested, so you can.
Or at least have tested.
Yeah.
And if it's under 30, I tell you what, even if it's under like what, 40, 35.
Yeah, we treat under 45.
Even if it's like under 45, which is considered normal in a lot of labs, I don't think it would hurt you. I'm not your doctor, okay? Some people do store vitamin D.
True.
Not many.
Yesterday.
We just did.
A chronic fatigue patient.
Yeah. So if you start taking 5,000 units of vitamin D and you start getting symptoms like
fatigue, pain,
more fatigue,
yeah,
pain in your legs, pain in different areas, then stop taking it. Usually it happens pretty quickly, I think, usually within a couple of weeks. It's unusual, but it happens. But we're just trying to draw the understanding that Epstein-Barr virus vitamin isn't immune. If you're reacting and getting the symptoms, it's probably your immune system is probably the problem. Whereas somebody else who has a very well high functioning immune system isn't going to have a problem, even though they test positive. And I have all these problems. I don't take that many supplements. We were just discussing that yesterday. Our goal is to not have people have to take tons and tons and tons of supplements. Our goal is to have your body work as possibly good as it can. The brain controls the whole body. Dr. Gates works with some of the neurological things that would stress, chronic stress affects you. So if you have Epstein-Barr virus and you're looking to take some for your virus and you're chronically stressed and your immune system is off, guess what? You have to fix those two things. And that's how it's going to go. You can try to kill the virus, but that's not necessarily going to work unless you handle the other aspects of it, which we talk about in our chronic fatigue module that we presented. And vitamin C, did you want to go into that a little bit more?
Yeah, so
you mentioned it.
Another study that we attached cited that taking intravenous vitamin C in high doses was associated with bringing down viral load to Epstein-Barr virus. Again, vitamin C is thought to help regulate the immune system. Some people say that the vitamin C actually attaches to these antibodies, helping the immune system to work better. We don't really need to theorize there, but we just know that it does help Epstein-Barr virus.
Okay.
In a similar mechanism.
And then medically, advanced cyclovir.
Okay, yeah. So there are studies using.
We want to give them the whole spectrum.
Yes, Valgen cyclovir, which is a very expensive antiviral medication, is effective at helping chronic fatigue patients. And the longer you take it,
if you're one of the ones that the virus is causing that
EBV.
symptom.
And the longer you take it, the better you're going to do, in essence. And Yeah, I was just talking to a chronic fatigue patient yesterday. She had been on that medication, but she's also been on valcyclovir, which is a cheaper derivative. It's still not cheap, but it's cheaper. And every time she's on it, she feels a little bit better. Then she goes off of it, she feels a little bit worse. And so these medications are just decreasing the way these viruses are replicating, giving your body a little bit of a break. But again, I mean, really the whole point of this entire broadcast is that it goes back to your immune system. How do 95% of us have Epstein Barr virus? Yet some of you get completely destroyed by chronic fatigue. Others develop cancer, others develop MS or other autoimmune diseases, whereas most of the population doesn't. Now, it goes back to the immune system, which is becoming an increasingly more prevalent issue in our current times. Now that 1/6 of the population has an autoimmune disease, which is really interesting because now 1/4 of females have Hashimoto's thyroiditis. So I'm almost wondering if that 1/6 number needs to be revised. I get that the 1/6 is a combination of males and females. But in essence, autoimmune issues are way on the rise. Cancer is still an epidemic. And it all comes back to these factors that we're talking about.
Yeah, it does. Did you want to talk about MS more specifically?
Yeah, and so with MS, they have gone into MS patients' brains who have passed away and done studies where they take out a piece of the brain and they see high loads of Epstein Barr virus in the brain lesions compared to healthy controls where they don't see those viruses. We also know that MS patients have high titers to these early antigens for Epstein Barr virus. We see it in their saliva.
Which is what we see in our patients who are largely autoimmune patients, those early antigen that he delineated out those 4 tests. And that's a test we use. That seems to be a test that seems to be most valuable in trying to figure these things out relative to the Epstein Barr virus. And immunity, in our world, immunity has a lot to do with getting cancer. I mean, in our world, it seems like it's coming down to like stress and immunity.
Yeah.
In our chronic pain patients, that's not the only thing they have.
Yeah.
But basically, that's where you got to start, and then we start with those 2 things in the gut. Sometimes the stress is causing the gut, but I don't want to get too off on another issue. But yeah, the more we do this, the more it seems to come down to you have a chronic fight-flight syndrome, you have post-traumatic stress syndrome, you have a bad immune system, you're getting a chronic problem. You are getting a chronic problem. That could be cancer, it could be MS, it could be an autoimmune problem, it could be whatever it is. But this is what we see over and over and over and over again.
And this is being acknowledged in the neurology literature now. It's fairly well accepted that Epstein-Barr virus is thought to be associated as a inciting or perpetuating factor for the multiple sclerosis phenomena. Multiple sclerosis is really more an immunologic disease than a neurological disease. It's just that the brain and the nervous system are what are affected by this abnormal immune response. And as I said before, Epstein-Barr virus is largely a B cell issue, whereas for MS, it's primarily a T cell issue with the Epstein-Barr virus. And it's thought that somehow the regulation of the immune system, like we talked about, becomes abnormal with MS patients in this interplay between Epstein-Barr virus and the T cells. There are a few studies, and I attached them, where there's some discrepancy on this, and they're thinking that maybe the inflammation in the brain from the MS patients is mimicking an Epstein-Barr virus response, but we don't need to go into that. I just want to present both sides here so you know what's there. Yeah. And yeah, that's it's rather profound actually. And MS is a complicated issue. There are other studies talking about leaky gut syndrome relative to MS, as maybe the gut breaks down first, that imbalances the immune system, allowing this viral interplay between Epstein-Barr and the immune system to be off.
When you do this, there's so many entry points, and then as Dr. Gates does the investigations and the research, he just seems to be coming up with more and more entry points. But as it's occurring, I'm seeing patterns that make me more comfortable in the way we're addressing this. And it's just, you have to, I think you start with the gut, you start with the stress, you start with the immune system, you got a pretty good chance. If you're practitioners, I think you got a pretty good chance of seeing some changes, some positive changes. And did you want to discuss cancer more specifically, Epstein-Barr and cancer? I'm not sure how much people are aware that Epstein-Barr could be involved in MS. And
Right. And this is where you
even
shouldn't worry. So a lot of people
well,
out there
you mentioned it. So
oh,
that's why
I have Epstein Barr virus. So
that's why I
means I'm
wanted
gonna
to
get
say
cancer.
maybe we should.
And that's not what we're saying. We're just, again, 95% of us have Epstein Barr. So pretty much all of us get Epstein Barr. And Epstein Barr is associated with certain types of cancer, specifically some types of gastric cancer. It is also associated with Burkitt's lymphoma, which is a type of lymphoid cancer that primarily occurs in like malnourished populations. It's very common in Africa. There are other types of cancers involving the nervous system. There are these things called chronic active Epstein-Barr virus infections that can also occur and be associated with cancer or lymphoproliferative disorders. So just know it is associated with cancer, but again, it goes back to the immune dysregulation as to why that's occurring.
Right.
Now, one thing I do want to mention is some autoimmune diseases. So let's go at Sjogren's.
Okay.
Sjogren's syndrome is a disorder where people have abnormally dry eyes and they don't make saliva. Their eyes lots of times can turn red and yellow, and they can have associated symptoms. With rheumatoid arthritis, it goes hand in hand very commonly. So rheumatoid arthritis, people get, nodes in their hands, they get swelling, they get pain, they get stiffness. Well, Sjogren's disease has been shown to be incited by H. pylori, which is a bacteria in the stomach that's present in at least 50% of us here in America, as well as Epstein-Barr virus. I think the numbers it's very, very high to where the Sjogren's patients have recurrent Epstein-Barr virus infection shown by the early antigen IgG titer. And so it's thought that there is molecular mimicry, which means when the immune system is trying to kill Epstein-Barr virus, if it gets overactive, some of those immune cells look like the lacrimal ducts in the eyes. That's what makes tears, as well as the submandibular glands in the mouth that make saliva. So as a consequence of that, your ability to make tears and saliva goes down and you become very thirsty and you have dry eyes. Lupus is also being talked about here, where everybody's searching for a causative mechanism to lupus. Lupus is a condition that can affect most organs in the body. It can cause arthritis-like symptoms, can cause fatigue, it can cause lung issues, it can cause kidney failure, it can cause sun sensitivity, it can cause rashes over the face, other rashes on the body, and Epstein-Barr virus, again, is in that discussion as being one of the critical factors for the immune system being dysregulated. And that goes back to what we were talking about relative to fatigue. I mean, when I was talking about the memory responses, basically 2 out of the 3 responses are not working. So, and then the other response gets overactivated and tries to compensate. Meanwhile, the virus permeates throughout the body and destroys your mitochondria, and you don't feel so good.
The little energy guys.
The little energy guys. So I think that is really what we need to say there.
So we started out by saying we were going to dispel the myths. That was kind of my title, and the reason that I said that is the overriding understanding of Epstein-Barr virus is it causes chronic fatigue. Not in the medical profession. The medical profession doesn't believe that, and with probably good reason. And when someone comes to me, when somebody comes to us, but I do all the intakes, as those of you who are patients here know, Carol and Julie particularly, again, thank you for reminding us that we haven't done this. I'm thinking somebody comes in and says, I am profoundly tired. I am lethargic. When those words start coming out of a person's mouth, Epstein-Barr virus is not the first thing on my mind. I'm usually thinking thyroid, blood sugar, adrenals, better known as stress, those PTSD fight-flight mechanisms that we're talking about, and gut. Now, somewhere in there, that Epstein-Barr, there may be an active Epstein-Barr virus that is contributing, but we would look at those areas first. And this is kind of what I meant in dispelling the myths. Maybe we should have done dispelling the myths on chronic fatigue, but we have one on chronic fatigue. So you can look at that whole thing. So is Epstein-Barr virus a cause of chronic fatigue? Yes and no. Sometimes yes. Most of the time, no, if you're looking at it as the specific silver bullet cause of chronic fatigue. As it occurs, but it's a small percentage of the time that alone would be causing your problem. And the facts are what we've been sharing with you for the last however long We kept it under an hour. Yeah. So those are the facts, and those facts are going to continue to evolve. One of the, I guess it's fun. One of the fun things about the way we've come to go about these, Doug Gates and I've been informed by my chiropractic neurologist that I am a very anal left brain person. Well, so is he. And you want that in your doctors because you're continually looking for specifics where you can just find that one little thing, that one little piece of data more that can advance your ability to maybe help one condition, or maybe help it quicker, or maybe help it less costly or whatever. And Dr. Gates is always on the research trail. And that really makes it kind of fun. So this is an evolving understanding. We have done updates on a number of topics that we did 4 years ago. I mean, how many updates have we done on fibromyalgia and peripheral neuropathy?
We were doing updates every 6 months because so much new data comes out.
So what we're saying when I say confirming the facts, these are the facts as of 10/23 on Tuesday at the end of February here, and that could change tomorrow. But we're sharing with you what we understand as the environment of addressing these things as of today, as of this moment, and in applying these knowledges and understandings in our practice, it has allowed us to become pretty confident in addressing these chronic problems, these chronic conditions, and so on and so forth. So I hope that is clear. We're not saying we know everything when I say dispelling the myths and confirming the facts, but I hope it's clear that what we tried to communicate here today relative to Epstein Barr virus, to those of you who are looking for some clarity on the subject, and I have a feeling that that's a lot of people. Right. So that's really it. Did you have anything else to add to that?
That summarized it perfectly.
Okay, so thank you for watching again, and again, thank you to Carol and Julie for bringing this to our attention. We only see this like every other day, it seems like, and we've never put a topic on. We've never put the topic online. And next week we're going to be doing Lyme, and there's going to be a very similar flow to the Lyme presentation as there was to today. And so if you know anybody who has Lyme problems, it might be fun to let them know, because I do think it'll be worth their time. I don't think it'll be wasted their time to watch this next week. So until then,
thank you for watching, and send us your questions at www.powerhealthtalk.com or to our Facebook page.
And he'll do his best to answer them.
I will do my best. I have about 10 right now I need to get
there you go.
So yes, I will do my best.
Okay.
All right.
Take care.
Thank you for watching.
All right.